Hello, I am happy to be part of the International Relaxation Day and to be talking about my topic of stress management through social mindfulness. I am Yumna Ali from Hazara University, Pakistan, and glad to be invited by Professor Stephen Palmer. So basically, what is social mindfulness and how can we understand social mindfulness? So basically, mindfulness initially has been promoted through different government and policy channels and different social initiatives and non-governmental initiatives, also educational academic initiatives now, because it is being studied and researched about. However, it's very important to drive the attention of mindfulness from an individual perspective to a socially aware perspective. So it's just not individualistic, it's collectivistic in nature. This is what a social mindfulness talks about. Social mindfulness creates a culture which recognizes that people have difficult feelings, to understand their feelings, and to describe one's own feelings without without being judgmental, without thinking that we're going to respond. That's why we're going to listen. And without jumping into the problem-solving mode is important, is what is said by Leonard. And the concept of social mindfulness by Leonard posits that mindfulness is just not individual, and it is social and collectivist in nature. And now, with relevant in the Western society, is also now important in the Asian society, that people think that they have an individual identity and they're going to thrive is that way and consider mindfulness as an individualistic concept, whereas social mindfulness says that it is not what it is collectivist in nature. And social factors are very important. People come from different backgrounds. It's ever evolving, different cultures. And social factors play a very important role in mindfulness courses rather than just mindfulness being focused on the individual. It's more about working together, gelling together in such a way that we produce meaningful relationships that are important in a civilized society and how it should work in a greater interest. And the amount of mindfulness practice does not contribute uh, the, to the greater levels of achieving mindfulness or the aspect of non-judgmental attitude. It's about accepting the present moment, to be aware of our thoughts, feelings, ultimately behavior and actions. It's about bonding with other mediators in the group and linking ourselves with the social agents. It's by sharing experiences with others to make a difference. It's only now that mindfulness studies are coming into the literature and the academic literature. And there was a study in 2021 now, which is recent, but we should know that mindfulness has been there for ages. Is now it has come into literature in evidence practices. That mindfulness uh, was understood by Mark Williams basically to treat depression. It was a depression trial in two cohort groups, one in Bangor University and one in Oxford University. Whether mindfulness is going to work or psychoeducational group is going to respond to it. So the Oxford group responded 50% to mindfulness and 50% to psychosocial training. But the cohort in the Bangor University didn't respond to any of these. So how are these groups showing these differences? That there's one group that is going to respond to it and the other would not. So basically the whole data was confounded. And this trial of psychoeducation MBCT showed between 2010 to 2012 that how the dynamics of the training or imparting the either the psychosocial elements or psychosocial training as compared to mindfulness, and one cohort is coming significant and is showing significant changes as compared to the other one. So it's important to understand that in that repression trial, which is a part of Stay Well trial, was a comparison trial, that how these two groups, in terms of suicidal ideation, were responding differently. So that's an interesting finding. Social mindfulness, when we talk about it, it's a natural process. And we all evolved, our ancestors evolved as hunters and gatherers, living in a small, intimately connected group of individuals working together, sharing and caring for each other, and that's how the societies thrived, where everyone feels safe for the group. They work for the interest of the group, but largely towards the community, expands towards the community and then to society overall. And we see ourselves as individuals who can apply ourselves to acquire social status, their ascribed roles, their achieved roles, and it leads to stress, to see ourselves at a specific mark. But therapy and self-help treat stress on individual vulnerability. But social mindfulness recognizes this as a natural response which is embedded in, of course, our environment. And social factors are very important. So what's important is that we need to feel safe and then lead life, which is important because we are interacting socially and virtually with so many people from whom we are unrelated totally, and we try to make a bonding, and there is no relatedness apparently because people are coming from different societies, different backgrounds, different cultures, and we are meeting people differently with different identities. It creates a lot of stress. So the amount of ancestors that we have come across, our ancestors have come across back then in their whole lifetime, with what we would be interacting on a daily or a weekly basis. So it's itself a source of stress. So social mindfulness is embedded into everyday life, and it's very important. When we talk about social mindfulness, it's important to understand emotional regulation, but in relationship with other people, because people are feeling different emotions, and we are in relation to them feeling different emotions, and there's an dynamic interplay and exchange of emotions and feelings, and how we can understand each other and give space to each other and listen to each other, but not listen to respond, and make the other person feel psychologically safe only when we feel psychologically safe in our thoughts and processes and actions and behaviors. How we can feel psychologically safe at workplace, and how we can promote that feeling to our workplace, then to our organization, then to the greater community, then to the greater society. So this concept of psychological safety that has come from Edmondson's work, and recently have taken a scale validation concept from her as well. And there is encouragement to understand psychological safety in Asian cultures also. It's in line with the concept of Mark Leonard of social mindfulness. And it's so interesting and so impressive to see that how the interplay of social mindfulness and psychological safety can go hand in hand together. And both of the constructs actually share similarities and may have the same outcome as a result. So psychological safety is about speaking without fear of judgment, admitting mistakes that are being done at the workplace or within their own community. People learn from each other and they try to improve oneself to make better decisions, to feel appreciated, and to foster diversity and inclusion, which is important. And the important aspect is by regulating our own moods, that we can learn to communicate to be able to stay calm and collected. But it's not about the individual, it's about the whole group that is being affected. and then to the wider community or to the wider society then on. So Edmondson's and Leonard's findings are very similar. And uh, in with the viewpoint of anthropology, it's very important to understand that diverse teams are effective teams only when they feel psychologically safe, because diverse teams are bringing different skill sets, different modes, different behaviors, different attitudes. They can drive innovation and team spirit and efficiency and may perform better than homogeneous teams without psychological safety. And it's a driver of innovation, which is important in the modern world. So there's a study in which there are teams with high psychological safety and without high psychological safety, and there are two groups which are measured on the continuum of performance and diversity. So greater the diversity, greater the performance, provided teams and people they feel psychologically safe. And then we have elements of social mindfulness, which is driven by autonomy, competence, and relatedness with people, and it is fostered. It's an understanding to foster social mindfulness on this behavior and to be wise enough to understand that there are different social and cultural insights. And it is only understood when there is greater emotional regulation with interpersonal aspects. And one of its first kind of study of positive psychology has been also conducted in Royal Orthopedic Hospital of conducting MBOE, which takes into account self-determination theory. It's very important even at the sample of healthcare workers, or can be replicated and applied to other samples also. Because the concept and the training and intervention is reliable and valid in a way that it shows that staying curious, describing experiences, listening attentively to the work life or the personal lives of people in the aspect of social mindfulness. And importantly, we need to pay attention to feelings while listening and noticing the impulse to give advice and stopping oneself. And at the other hand, noticing the tendency to make judgments instead. To stay curious. Now, there are distinctive characteristics between the traditional MBCT and the novel MBOE. Not all groups or not all cultures or people would appreciate the power dynamics between a teacher and a student, therapist or a patient, or a one-on-one level. Most people innately want themselves to feel connected on the specific similar length or frequency or level of the practitioner of the mindfulness. So when mindfulness is a course or a psychological model, for example, mindfulness meditation, how it prevents depression, is a group therapy where there's a therapist and there are people who sit in a group and share their feelings and follow the mindfulness meditation instructions with the presence of a teacher. But in MBOE, rather than a teacher, there is a mindful practitioner, or rather a facilitator of group processes who imparts the essence of social mindfulness. So instead of becoming him or herself as an own source wisdom center, rather interplays as a facilitator in a very subtle way so that people can lower their guards down and can break the shackles of the individuality in such a way that they can socially integrate, which was the basic instinct of the all societies. It's to facilitate the group processes, to feel comfortable, to have a comfort zone, and to learn the difference, and to understand what kind of relationships are produced after the intervention of MBOE, the mindfulness-based organizational education, and after that instruction, and can avoid any moral injury, for example, at workplace, to reduce stress levels, and to curb burnout, and to improve professional quality of life of workers, and especially also in communities, in different samples of social professionals, healthcare workers, teachers, doctors, skilled workers, practitioners, trainers. So it effectively approaches the dynamics of conflicts of power also, because when you're socially mindful, we understand the aspects of each social agent in a very socially intelligent manner. And this aspect affects the modern workplace. So stress arises when we're stuck in the individuality of the mindfulness and the meditation, not spreading and uh, assessing its outcomes and results if it is practiced in a socially mindful manner, which is a novel intervention. It is a novel in a recent developed technique or instruction that has to be integrated in different facets of life, which can do ourselves, our societies and communities and groups as a whole a great favor. Now, mindfulness-based organizational education had a trial outcome. It was studied at Royal Orthopedic Hospital as an intervention in relationship with the five-facet mindfulness questionnaire, with basic psychological needs at work scale and perceived stress scale, and just show that the 10 minutes mindful meditation sessions in our busy work routines can help us bring socially mindfully into the world rather than taking us out of the world through a meditative practice, and to gel in and to integrate with others at different hierarchical levels. For example, if it is being instructed as an intervention healthcare organization, it will connect the supervisors with the main frontline workers of nursing and doctors, and then the nursing staff and the doctors would then socially interconnect with the patients, and patients with their family members back home. And this is how the loop feeds within this specific energy of social mindfulness. So the intervention shows significant outcomes in the study that is referenced. So MBOE is internationally recognized with IPA and ensures the quality, integrity of the program. It is vital in Eastern and Western societies because when the concept of individuality and self-concept is so high initially, that people would avoid social integration with the concept of mindfulness in their in their in their intelligence levels and their interactional interpersonal levels, that it can actually hinder a lot of the progress resourcefully, or even it will impact stress in a negative manner. So MBOE in a social aspect is very important to be understood. Moreover, this program is highly significant because it creates a new model for social mindfulness, which drives change within oneself, within a group, within community, within an organization, socially, and it has far-reaching impacts. So, social mindfulness is a concept more and it's a philosophy. It is a practical implication of how we can be important social agents at the same time be very mindful in our uh, own capacity, and to facilitate from one part, from one aspect, from one area, from one organization, from one group, from one individual to the other, to have a multiplier butterfly effect. Thank you.